Welcome to the LifeUnpacked podcast with
Dr. George Ademinta.
Kwabena Boateng. And today we have a very special guest. And I'm very honored to have this amazing personality here. And before I introduce her, I just want to say a few accomplishments that this person has, so that when you see her, you know who you're talking to because she knows what she's saying. So I'm going to start right now. And this person started her career as a registered nurse. And she's been in the medical field for over 15 years now. That's a long time. And she's worked on multiple specialties, multiple fields, specialties, which includes ICUs, oncology, hematology, with research in National Institution of Health. In 2015, she went to Liberia to support the innovation of the Ebola vaccine at NIH, and it was very, very rewarding. She was an adjunct faculty professor at Howard Community College, nursing department from 2019, right before the pandemic, to 2023. She received multiple awards, including Director's Award at NIH, just to name a few. With a vision in mind, she saw the need to further her education, to make change in the society to better serve mankind. So she decided to get a doctorate in psychiatry, and that is it's amazing, because it's not easy for you to just get up just because you want to serve mankind, go and get something, a degree, so that she can help all of us. So this is very, very special. She's a board certified. She currently works with a company called Unit Healthcare at Washington, D.C., at the psychiatry department. She has her own practice called Blessing Medical Consultants in Silver Spring, Maryland, providing comprehensive mental health services. She also has an NGO, and the purpose of the NGO is to break stigma that surrounds mental health and to make mental health awareness to African descent, both at home and in the diaspora. And she's married to Mr. Samuel Bediako, and who is her number one cheerleader. And we all need a cheerleading spouse. Yeah, so she has that cheerleader as well. And she's a mother of 5. Wow, she has 3 girls and 2 boys. And she's no other than Dr. Joyce Oppong Bediako. Doctor, welcome to the podcast today.
Thank you. Thank you so much.
Yes.
Thank you.
And thank you for honoring our invitation.
It was an honor. I was very happy when Pastor called me, because I've always wanted this opportunity to speak, so that people will know that they are not alone.
Right.
Mm-hmm. They are not alone.
Well, I know this today's discussion is going to help a lot of people. I did a survey. I was asking people what we should discuss. And the number one thing everybody was talking about was mental health. Yes, so I spoke to Pastor about it, and Pastor was like, we have to bring you on board. Yes, so welcome.
Thank you. Thank you so much.
Welcome.
Thank you for having me.
Yeah. Doctor, do you have anything to say before we go?
Yeah, I'm glad Dr. Bediako is here today, because it's not everything that is spiritual in nature. One of the things I learned when I took a program in biblical counseling was that as a counselor, you need to know where your limits are. Some things need to go to professionals. So I know that I can't answer all the questions on mental health. So we need to bring somebody who is a professional, who knows what they are saying. And so I may know the Bible more than she does, because she's in my congregation. But when it comes to mental health, she's the expert. So I'm going to be here to listen to her too and to learn from her. Thank you.
Okay, so Doctor, I want to start off by asking, what is mental health?
Okay, Kwabena, thank you for asking. So mental health, it has a broad definition, just not to bore down your audience. I'm just going to keep it simple to our terms. So it's a syndrome. It's a syndrome that affects the emotions, the mental behavior, the psychological behavior, and all this syndrome coming together, it impairs or affects the way we function in our daily activity. If you don't seek help, it's really going to impair your daily activity, and it will dysfunction you, and then you will not be able to move forward. The end result of mental health, if you don't address it, is suicide. And that is what our young adults, our teenagers, that when they are having issues that they don't have anybody to address it to, they don't have any resources, they feel like they feel worthless. Because one of the side effects is a feeling of worthless, a feeling of guilt, a feeling of being wasteful. You just sit in your room and you look at yourself and you feel like, oh my goodness, what am I doing here? I'm better off to check out. And that's what most people do. But I am here to encourage everyone that is going through mental health that there are help out there. There are a lot of helps, especially in the U.S. Statistically, 59.3 billion is affected by mental health. Just 2022 is approximately 23% of the U.S. adult population, just U.S. adult population. And this statistics is from the NIH website for mental health. So because of that, the government has really found interest in people that are suffering. There are crisis hotline that you can call and talk to somebody. And there are people like me that we're out there that we understand what you are going through. There is no shame that you should be able to let somebody know that you are not okay.
Wow. So I have a follow-up question. Are there types of mental health?
Yes, thank you. There are a lot of mental health disorders. We have multiple of them. The most common ones that we see every day, we have the depression, we have anxiety. Some people have bipolar. Bipolar is biological. It's also from environment. Some environmental affects people to have bipolar. We have the ADHD, which affects students, school age. ADHD is normally diagnosed as a toddler or a preschool, and if you get an attention, you'll be treated. You'll be under a psychiatrist for all your life, and it's very manageable with medication. Some just ignore it, and those are the people. What I've seen in ADHD are individuals that are highly intelligent, but they are very unstable. They cannot complete one task. They are so highly intelligent, they see that, okay, I'm going to pick up this bottle. They will not finish picking up the bottle. They want to do laundries. They will not finish the laundries. I'm going to cook. They won't finish. So they don't have the strength to complete the task. They just keep touching everything that they see. They want to do it. Their brain is so very highly that they cannot finish one thing.
If I may ask, what does ADHD?
Attention.
What does it stand for?
Okay, ADHD is attention deficit hyperactivity disorder.
Okay.
Yes. And we have two types. We have the hyperactivity and we have the inattentive. The inattentive person will be talking to you and then their mind is wandering around. Ooh. And then the hyperactivity, those are the ones that I just described, that they will just they don't know when to complete the task. Very fidgety. And those people I see, doctors, lawyers, very prestigious people has been affected by ADHD. But because it was addressed, they saw a profession and they're under treatment, and it's very manageable. Mm-hmm.
Thank you. Doctor, do you have anything to say?
Well, very interesting. Lack of focus, when we're young.
Focus, lack of attention
and,
highly fidgety, doesn't know when to finish one task, then they start another task. Yeah, those are ADHD. And then we have autism. Okay. Autism is also another mental health disorder. We have the bipolar, we have two. We have the bipolar 1 and the bipolar 2. But the bipolar 1 is it comes with most of the depression symptoms. You see most of the depression symptoms in it. The bipolar 2, which is the hyper, They are the ones that, so a person who is being affected by bipolar 2, they will stay up all night. They will not sleep all night. And in the morning, they still have the energy to go. Wow. And then they engage in very highly strenuous tasks. Their dreams are bigger than they can even think of. A bipolar 2 individual will tell you that he or she can walk from here to Ghana. It will just come out of their mouth. And then as soon as she says, you know what, I think I'm just going to put up a break, I'll be able to build a White House in 2 days. Wow. They engage in highly adventurous activity that they can't even dream of doing it. But they will say they spend a lot. Bipolar 2, when they're in the manic phase, they will spend all their money in their bank account until they feel better. Some also will engage in sexual activity. They will just have sex with anybody they see. And when they get into the manic phase, that is also there. We have the social anxiety, people that goes into social gathering and they start sweaty, they feel like something is it's impending doom. Yeah. No, they can't even walk. They also have the panic attack that people cannot walk on bridges, So we have a multiple of the disorders. It falls under multiple of the compulsive disorder. The OCDs are also another mental health illness. So there are multiple of them, yes.
So something like with the bipolar, right? I think initially you said that some people were born with this, right?
Some were born, they have biology, yes. Okay. Some is in the family genetic.
Okay.
So if your mother has a bipolar 1 or 2, if your father, there is it's just like a breast cancer. So that's why when I am talking to these individuals, I try to let them understand that when your mother has a cancer or any type of chronic illness, you have this mentality that, okay, let me check myself annually just to make sure that I do not also have it, or even if I do, it's being detected and then addressed. So in the same way, when you are an adult, 21, 22, and you know that your mom has a bipolar, it is okay to get yourself evaluated, yes. It is not shame, and that's something that individuals find it very difficult to accept. They're always in denial until it becomes complex. Mm-hmm.
So that means some people can be okay and all of a sudden it starts developing.
The bipolar 1 and bipolar 2, if it's a genetic, you will see it in the teenage, at your teenage years. Yes, you'll be seeing the symptoms at the teenage years. And so is ADHD. You also see that. Mothers that have ADHD, most of them, their offspring also have that, the genetic, and then they address it. I have one patient that I'm treating. Yesterday, she called me and said, no, I think I'm going to ask you to see my son. So I said, how old is your son? And she said, he's 8. And the symptoms that I had before I came to see you, I am seeing him exhibiting it. There are biological, some genetics, and also environmental. Example of environmental is males and some females that are sexually molested. It affects them mentally for the rest of their life. If they don't have a strong support, because if somebody gets sexually molested, they blame themselves. They feel like it was their fault. There was something that they did wrong. So with this guilt feeling carries them through life. If they don't see professional help, they get affected for the rest of their life.
Listening to what she's saying, for me as a pastor, I'm seeing that most of these things, symptoms, most people attribute them to only spiritual problems. And that is why I think we err sometimes, because just like how I think you related the biological side to it. For example, if somebody has breast cancer and they come to me, what I'll tell them is that go see a doctor, let them treat you. I'm going to pray for you because I don't know how to treat breast cancer. So the same way somebody comes and they have a mental health disease, I will pray for them, but I want them to go see a mental health patient because no matter how I shout, unless they are treated, it's not going to go anywhere. So God can do it. But I think that all we know about diseases and so on is because of the wisdom that God has given to man. And God, all these doctors are also being used by God. So I should do my part, but I should let them go and seek help also. And that is where I think sometimes we err as pastors, in that we think everything is spiritual. It's very interesting you raise the issue of the fact that I think the bipolar, they can be involved in a lot of sexual activities and so on. So if somebody is having the issue and maybe you are counseling them, you are doing all that, it's not working, maybe you need to let them see a professional. Maybe they are really sick. Yeah, so it's all a part of medicine. Yeah. So just like how we see people treated for blood pressure and all those things, it's the same. Yeah. I don't see any big difference.
I realize that a lot of people take their spiritual life, they take care of their spiritual life or spiritual being, they take care of their physical being, but they don't take care of their mental being, and they attribute it to their spiritual being, which is a separate thing altogether. Yeah, so I'm glad we are here discussing it, because there's a lot of people going through it and they have no one to talk to. Yes. And they have no one to talk to. So I'm glad we are talking about this. And I have a question. So what are some of the things that triggers, because I know sometimes things trigger, especially the bipolar. Yes. So what are some of the things that trigger so that anyone who's watching it can know, okay, I don't have to do this because it might trigger this thing from her. What are some of the things that trigger it?
So the bipolar, because it's a disease itself, and also it has the genetic component to it, one thing that could trigger a bipolar is also a life event. Mm-hmm. If they hear bad news, somebody who just got fired from his or her job, somebody who also just got a bad report from the doctors. At life events, losing your house, losing a family member, anything that is trauma, any traumatic could trigger it. And also the symptoms also comes, especially in the winter season around this time. It happens more so when we change the time. When the clock is turned backwards and it's 5 o'clock and it's darkness, individuals that are single, individuals that really don't have much going on, and then they look outside and they see that, oh, it's 5 o'clock and it's darkness, and then, oh my goodness, I have to be in this room all by myself for the rest of this night. It triggers it. Seasonal one, that is the seasonal one. And then also emotions, because there is a chemical imbalance that involves in it. Anytime the brain, any small incident that triggers the brain, it will trigger it. Yeah.
I have a question. So these days we hear about young people committing suicide, and sometimes you see them, they're fine, and the next time you hear they've committed suicide. Recently I saw that a gospel musician who was good, recently led worship, and all of a sudden he's just what are some of the things that you should look for someone who is someone who's going through something? Because most of the time they look okay. They look like everything is fine. You talk to them, they're hyper, they're cool. Next time you hear they committed suicide. So what are some of the things you have to look for in those people that you can help them prevent some of these things from happening?
Okay, thank you. So because of this suicide rate that is increasing, the U.S. government has included a screening. We call it the PHQ, the Patient Health Questionnaire. And now it's across board. It used to be only mental health that we screen. Now it's also in primary care. So the first thing you do if you're a new person, you put in your demographic information, your insurance, your address, your driver's license. The next questionnaire is the PHQ screening. When they do the PHQ screening, they ask for the questions that triggers it. An example is for the past 2 weeks, have you been feeling depressed? Have you feel worthless? And then the next one out of my head, I think it's 10 items. The next one is, have you felt guilt? Have you felt like you've left yourself down or you've left your family down? Do you have trouble falling asleep? Do you have trouble eating? And all these items, the point is 27. Mm-hmm. So anything from 8 to 8 over 20, so we score it. If you say yes to all of them, which is a scale of from 0 to 3, so if you check 3 in all these questions, you are going to total 27. And that is very severe depression. So you indicate on the form, there is a place that asks you, do you thinking of harming yourself or harming somebody? Some will say yes. The moment they say yes, you have to ask them if they have a plan. If they do have a plan, so my job is to send them one. I'll call the 911. We're at the crisis center. I call the 911 for them. If a patient is seeing me from home, the telehealth, and they say yes, I ask, do you have an adult with you? So at that moment, we get into a contract. I tell the adult, we recording that you are going to send your cousin, your niece to the emergency room, and then he or she needs to be monitored for 24 hours. At the emergency room, they will find you a one-on-one, a suicidal precautions. So those are the things that we look for. The screening, the PHQ screening, that is across board, or if somebody is close to you, you see that they don't even, the things that normally they like to do, they don't do it anymore. They lack interest in the things that they used to do, call it ahedonia. They don't want to, somebody who likes I always tell people I like Brother PC a lot. So
even if you like it.
That's the example that I normally use. So if I have not been eating this, my Brother PC, if you are close to me, you know that this lady, there's something wrong. And so that's when you start at least talking to them or probing. If they're comfortable with you, they will open up. If they're not comfortable with you, some will not even say anything. Yeah.
And I think I like the part where you talk about when you are close to someone, you should observe them. I, as a pastor, for example, people tell me certain things. And I remember one time, early in the morning, somebody called and we're chatting and they made a statement. I don't really feel like living anymore.
You see?
So straight away, I told the person, you know what? And I know it's somebody who will listen. I said, do me a favor. Call your PCP right away. Yes. Because I'm not a doctor and I can't really diagnose it. And I told him to call a suicide hotline. But when I said that, he was a little apprehensive. So I said, call your PCP. So I said, after you call your PCP, call me back. When he called the PCP's office and said, I was talking to my pastor and I made this statement, he said I should call you. Immediately asked him to come in. So the PCP did an evaluation. That's the primary care physician. Did the evaluation and decided that they were not at a suicidal point, they were just slightly depressed. So talk to them about certain things that they need to change in their life. They were going through some crisis with their marriage and all that kind of stuff. So he referred them for some counseling and he's fine. Wow. But as soon as he made that statement, I have the professional involved. And I think with our friends, when we see these things, pray for them. I pray for this person. When I asked them to call a doctor, I started praying for them. But it has to take a doctor to do the evaluation to see where they are. But I don't want to see that they've committed suicide. So I said, no, call your PCP. That statement you made, I'm not going to let it go. So we need to watch out for ourselves too, our friends. Yeah. Very, very important.
I think one thing sometimes people are just our friends, but we don't watch their well-being because as friends, you have to always be there, know who your friend is. So that if there are slight changes, you can always be on the, you can tell.
Exactly. The common word, are you okay? Are you feeling okay? Are you okay? Some people have not had anybody asking them that question. And I hear that a lot in my office. Because the first thing I ask them, are you okay? What brings you by? Somebody would just burst out crying. And then when they finish, they say, no, doc, you know what? For the past 2 years, nobody have asked me. I am okay. Pastors, they are giving. They are human beings, They have all these shepherds that they are looking at their families. They have, children, they have grandchildren. Who is looking out for them,
And I think there are pastors watching also. This is very key. Well, everybody depends on you. And I think the whole world also holds up to a very high standard. So I think a lot of pastors have issues because they feel they are failing. And I've read statistics and surveys which show that a lot of pastors, actually a high percentage of them are considering leaving ministry because they feel they are failures. Because they feel they can't meet the standard. But one thing, in fact, somebody was asking me, someone I preached last week about Elijah, how when Jezebel threatened him, he went to God and said, please let me die. That's Elijah. Then I say, so how can Elijah, a great man of God, after such a great victory on Mount Carmel, how can this happen to him? And I said, you wouldn't know that until you are in a position like him. When everybody is depending on you and you feel so strong, then all of a sudden they select that. So many pastors have that issue. Then you come to your church, everybody is looking at you. So who do you tell that you are depressed? Who did you tell that your marriage is not going well? And in ministry too, to be honest with you, when you tell your boss also, then you also, this person has problems. So then you also begin to look down on you. If you tell your colleague, it's an opportunity for them to probably defame you so they can also take your communication. So it's like everywhere you see threats. And so it becomes very, very difficult, and that's an issue. And everybody, once you are human, we are in earthen vessels. This body is frail. So no matter who you are, so it happened to Elijah, it can happen to you also. And moreover, if you are just an ordinary person, a young person, if somebody has the level of Elijah, it can happen to them, then who are you? So you shouldn't feel ashamed. To seek help.
You should not feel ashamed.
And the person asked me actually, how are you to do it? I said, because I don't take myself too serious. And I said this to the person, the guy started laughing. This so I think the problem, we hold ourselves too high standard. After all, Jesus died for you. How can I die for you? No, if you have, I can't do it. But I think sometimes we push ourselves too high. In academic world, I must always get A's. He said that, there are subjects which I failed in school. I remember one time I called a young lady, she was in nursing school, and I taught her in youth class, and I called her, but I figured she was crying. I said, what are you crying? I just failed the course. And I said, let me tell you something, you know in college I also failed the course. I said, you? Oh yeah, So I told her my experience, and I said, after that, we kind of got things now. And I said, look, sit back, be more of a strategy, and go take it again. And today, thank God, she said, yes. Although I think we take ourselves too serious, we push ourselves too bad. You fail, so what? You're on the fence for you to fail. You do something else, you pass. Anyways.
And Pastor, I'm glad you brought that this topic up. A lot of young adults, students, that's their issue. Yeah, a simple failed class, especially if they were studying with a friend. You know how you have a buddy that you go to the library with. You guys are spending the same amount of time reading the material. Sometimes, you feel like you are even more smarter than your colleague because maybe there's something that the colleague did not know, you explain it. And when you explain something, when your colleague explains something to you, you understand it better than the professor. Some students are like that. And then you see that you are the teacher, or when you guys meet in a study group, you are the leader. And then everybody else pass and you fail. People commit suicide a lot. People commit suicide a lot, because that is a failure for them. Why I was the one who was teaching in the group, I was the one who knew everything, and why did everybody pass and I failed? A lot of students, they end their life for that, which is very irrelevant. Which is very irrelevant. So like Pastor said, when they come to me, I tell them to take it again, take a strategy. And when you go into the second time, you'll be more smarter because you understand the materials. The new students that are coming in, they don't know it. You have been through the same professor. You know the professor's style, so you'll be brighter. And they come back successful. That's when they seek help. That's when they seek help,
And also that every human being has weaknesses.
Yes.
So you can't get A every subject. I think I've said it before. Chemistry, I have to learn how to understand chemistry. It's always been a thought in my flesh. So I try to take the minimum to pass and get on with my life. Why should I try to excel in chemistry and get A's? But when it comes to math, it comes so easy to me. But it doesn't come easy to somebody. If you look at me, they say, yeah, I'm brilliant. Remember one time somebody told me, we're in college, somebody told me, they said, I have a big head. And I said, that's what I mentor. And I said, math. I said, okay, that explains it. So I enjoy that. But the chemistry, I stay away from. And so you will have, there are courses you will fail. And I see young people also, sometimes, who, the academics, English and so on, they can do well. When you come to art, they are very good. So why don't you focus on developing that instead of getting depressed by the fact that you couldn't get A in math? So I think it's a whole lot about attitude is part of it.
It is, and it's part of it, yeah.
But and you guys saying this thing, right? Sometimes there's also pressure from the parents.
Yeah.
African parents always want your child to always go to the highest.
Yes.
You understand me? So, Doc and Pastor, what would you say to these African parents with the pressure that they put on them? Because a lot of people underestimate that kids also go through depression.
Yeah.
You understand me? And it's very serious. What would you guys say?
I think let the African mom be
So this is what I tell the African. I used to be like that until I got into a certain. And pastor's preaching also has really molded me. Whenever he preaches about academic, especially during the graduation season, he preaches about the academic. What I see is that you have to let your child be him or herself. Everybody has a talent, like Pastor said. Some African parents they themselves, they wanted to become a lawyer. They wanted to become a doctor. We have so many setbacks. We came from somewhere else. We have to come here to seek the green pasture. So maybe your mom or your dad was in Nigeria, Ghana, African country, and they wanted to become a doctor. They traveled to United States. It's not that easy. Because before you are accomplishing every stage, you feel like I couldn't do it. So then they put all those expectations on their children, which is not what they wanted to do. Their children also have their own aspirations, they have their own visions, they have their own goals. So make sure you know your child, their strength. Like Pastor said, whatever they are good at, please encourage them. Encourage them to do it. Don't put your aspiration, your goals, you want to be mother. Don't let it be your child's goal. It's not realistic and it's very not feasible. They will not be able to accomplish it. You are pushing them to commit suicide because they feel worthless. They feel like they have left their parents down. So what am I going to do? I have to end it all. Yeah.
Pastor, what would you also say?
Yeah, it's true. What you're saying is true. I think the streets I'm in on Revelation, each of the churches, Jesus says, I know your work, and say some good things they've done before he says them. And our children are doing very well in a lot of areas, but the failed area is always what we want to hammer. And I think that is the error that we make as parents. A child cannot have all A's. And like I told you, we went to my son's school, they did a state about African parent laws. And they said, for the white parent, when the child gets beat, beats are beautiful. For the African parent, you get a beat, I'll beat you. I mean, we need to ease up on them. There's a lot of pressure on them. And I believe that we, the parents, our generation, the pressure on us was less than it's on these kids now. The level of competition in their school, not in academic, just fashion. Social media pressure is too much. So when they come home, let's create a safe space where they can be themselves. And I've seen some parents, actually I've talked to a parent who this girl complains about the child. It's like now it's like the child is maturing. And we are talking, they're saying the child is doing well in school. They are showing a lot of maturity. Let them be children and let them grow. And let's ease up on them, let them find their strengths. Our children are more in the 30s. And when they were younger, teenagers, you would think there's something wrong with them mentally. But as they grow, they mature. So let's allow them space to grow. When a child is running around, they have so much energy. Let them run. Let them break a few things in your house. Yeah. You replace it. In Africa, you grew up, you were like free range. The houses were big. You go out, you run everywhere, you yell. Nobody. But here you are in an apartment. It's enclosed. And into the energy, they'll break your stuff. So let's ease up on them and not be part of let's not contribute to the problem.
The problem, yeah.
Okay. So, Doc, in talking about mental health, I want to chip something in for our wonderful women and females out there. It happens to both men and women, but I want to emphasize on the women first. People in an abusive relationship, it looks like, yes, sometimes they are being abused and they are still stuck in a relationship. They can't move on. Why does this happen? And what can help them move away or break away from them being in these abusive relationships?
Okay, thank you. The significant reason is self-esteem. You know, we have, there is a hierarchy for Erickson. When you go to psychiatry school, that's the fundamentals, from baby to old age. They call it the Erickson stages, which is every stage a human being accomplishes something. A newborn has to have a trust with the parents. When the newborn is crying and the parents pick them up, that's when they find their comfort. You know, they become a toddler, then they start exploring that, like our pastor said, they start exploring their environment. So the parents that are watching these children grow, part of them, when they would develop their self-esteem, is from the environment that they are raised in. Self-esteem starts from a toddler. I will be able to tie my own shoes. That is a task for them, you know. So the moment they're able to tie their own shoes, they're able to potty train, all these are stages they have to go through. They become a preschooler, you know, you become a kindergartner, you go through your middle school. There are stages that you need to accomplish. If a stage is lacking, if you are not able to tie your shoes as a toddler, right there you feel like you have failed. No, if it is not corrected, that's where the self-esteem has started breaking off. You know, they will instill, those that are introverts, they will instill this in themselves. I wasn't even able to tie my shoes. No, my mom says I will never do well. Of course, my mom is right. This is a conversation they have with themselves. My mom is right. I will not amount to anything. I have never been able to do anything good. So the self-esteem starts as a young age. So when they get into a relationship, they have already defeated themselves. So this relationship is not going well. What am I going to do? I can't do anything. No, since childhood, I wasn't able to. I did not accomplish those taxes. Now I'm in a relationship. If the husband is the one who is making more the money and then taking care of this woman, that's even worse, because the manhood and the man's superiority has already defeated her. So she will stay in. And if that person did not seek help or does not have a support system, a resources, somebody to tell her that you can do this. If you want to come out of this relationship and you start something on your own, even if you go to something small to do, you can do this. Sometimes all they need is encouragement. That is when they are going to start. So even the person may be 30 years old, but that's when he or she starting tying her own shoes. Now she can tie her shoes, she can put her shoes on, now she can jump, you know. So all those childhood stages that she missed, every small accomplishment is going towards that until they become to a potential that they feel like, oh, okay, now I can do this. So when you have lack of self-esteem, self-confidence, it diminishes you, and it will make you stay in an abusive relationship because you have already defeated yourself. Your guilt, your worthless, and all that. So this is the man or who is the woman who is taking care of you. And when you go out, what am I going to do on my own? I can't even do anything. I wasn't able to accomplish a small task when I was a child. At this age, 30, 40, what am I going to do? But it's never too late. It's never too late, yeah.
So how can they break out of this thing? Because a lot of people who they know it's not right, they know this person is evil, but they can't kind of identify that as low self-esteem. So what can they do to break out of this?
They need to have the boldness, and they need to speak up. They need to say it to somebody that they can trust. And also, if you are a mentor, you know, Pastor always encourages us. And I like Pastor's teachings. There are so many that are hand in hand with mental health. Yeah. He knows that he's doing his job as a pastor, but when I'm listening, it's really intertwined with mental health. You know, get a mentor. You know, if you are somewhere, I think this last year's graduation preaching is one of them. She said, pull somebody with you. And that has really motivated me. I have a lot of mentees. at this church and even around. People that wants to do something and they're afraid, like you are saying, they are in a relationship that is very abusive and they don't know where to go. Pull out somebody out, because somebody is out there, really needs help, wants to talk to somebody. If you are going through a relationship, if you are going through anything that is making you feel like you are a failure, look up for somebody that you feel like you can talk to and come out. There are so many resources out there. And that's one thing I truly like about the United States. They have resources for everything. They have resources. You don't have to stay in a relationship, abusive relationship or anything. There are resources for you to build yourself, to thrive, start doing something on your own and being able to survive and be independent. Yeah.
Thank you. Today I have a lot of questions. Okay, so I have another question, right? You see, most, like you're saying, mentees and mentors, right? Most people, let me say women, right? Their first role model is their mom or their parents, right? So let's say, assuming a woman has been raped and let's say, or have been abused, and they come to their mom. Because in the African setting, there are so many females who've been raped and they came to share and they were debunked. They made them feel worthless. So if, let's say, a girl comes and like, this man, and probably the person that is saying is someone that they respect, maybe her own uncle, her own, like, a lawyer, or maybe someone that they respect in the family. They'll come and say, the person, they'll be like, no, you tempted him, or you were wearing short this and this. And that can defeat the one who was raped. So what would you say on that?
Comrade, thank you so much for asking this question. You have no idea how many females that has come to me and their uncle, their nephews, their brothers has been molested them. And just like you said, they went to their mom and the mom did not believe it. They went to an adult figure, somebody that they look up to, and they did not believe it. If you are listening to me, if any person comes to you that he or she has been raped, take it to the next step. Ask questions. Let that person seek a professional help, because it is true. Most of those people that are deeply, deeply wounded, depression, anxiety, they were raped as a child, and their brother, their cousin, somebody that was prominent in a family friend. I see that a lot in our Southeast population. Somebody had a child with her brother. When he started sleeping with her, she said she shared with her sister. Her mom was in jail. Grandma was taking care of them. There were 5 of them, so grandma was always at work. So the sister that was a little older, she said she told my sister never believed me. So anytime we are going to sleep, she said she will cry because she knows that the moment the sister sleeps, the brother will come and sleep with her. And in the morning, she tries to explain it. The sister did not believe. Then, like you're saying, because it's a family, something in the family, let's cover it up. It's wounded. It's a gun in their head. It's wounded. It takes a lifelong therapy for them to come out. They never come. Some will never get married because they have defeated themselves. They feel filthy. No, they feel like they are not worth in society. So most of them don't get married. Their relationship is destroyed from there. Yeah. If anybody comes to believe it, and pastors too, Pastor, when you guys have your pastors meeting, there are some patients that has expressed concern that I went to my pastor and my pastor said, I'm lying on my brother. I'm lying on my brother.
I'd like to add a little bit on that. I think one area of pastors we need to what we can do also to help people in this situation is to create a safe space. Mm-hmm. I realize that most of our churches, the authority figures are all male. So you don't really complain that or say that somebody has raped her. And you invite her to come and tell her story. And there are 5 middle-aged old men sitting there. This teenage girl is narrating the story to them. It's not safe. Mm-hmm. I remember sitting in one situation like that where it wasn't gay, but I was a leader in another church, and the young lady was narrating the story. The young man was there too, and I looked in the room and I realized we're all men here. Mm-hmm. She was the only female. So I stopped the meeting, But I think there's some women around here to hear her story so she'll feel safe. I think in the African community, that's part of the problem. Most authority figures are male. So when it happens, and then it comes before them, because they are male, they don't understand. Sometimes some of them also have issues with it. So they tend to become very defensive. So we need to be careful and watch those dynamics so we can have women also in leadership who can help the young ladies in such situations.
Wow. Thank you so much for this. This is a very, very deep and emotional and very sensitive topic. So I'm glad you've said something about it. And I hope everyone watching us who's been in this situation should know that it's not too late. It's not too late. And there's something promising ahead. Just open up to someone who can help you. And I know I've spoken about men, but a lot of us men also need mental health. Because growing up, especially in the African community, we always hear men means men don't cry. Men don't cry. And I feel like some men go through a lot, but because they have that whole thing that men don't cry, you're supposed to be hard, they always shrug and they deal with this within. And that's what causes the suicide rate in men too. So what would you say about this? And what can we also do as men to do better in seeking help?
And then men also, Cobra, men has ego. Naturally. No, we are the weaker vessel, women, but men has ego. No, they don't want somebody to know that, no, they are weak.
Yeah.
I mean, for lack of a better word, it's not weak, but they need help. No, they are trying to handle it themselves. Talk to somebody. When you have headache, you say, oh, I have headache. Somebody, do you have Tylenol? It's the same way. Yeah, if you don't feel well, if you feel like things are not going well, seek help. Talk to somebody. Open up. Be honest with somebody. We have a lot of successful men out there. Become a mentor. A pastor says, be a mentor. Reach out to somebody and be a mentor. And talk to somebody. We have young men that are looking up. One of my patients says she's looking for a mentor. So I said, no, I don't want to include my religion into my profession. So I said, what's your religion? She said, no, I used to go to church, but I don't go anywhere. I said, do you want me to invite you to my church? He said, yes. So I knew that if he comes, he's going to join a cell. We are cell-based. Of course, he will bond with somebody. And from there, she told me, he said, no, doc, all I need is a man to look up to. It's very simple, but that is something that he's been longing for all this while. So, men, Bema soon, now it's Bema to me soon also. Talk about it. Just say something to your friend male. If you are going through marriage difficulty, find a man who is also married. There's some men that are not married, but they also are very reasonable. They can guide you. You are a human being. God gave brain to everybody. If somebody is misleading you, you should be able to know that, no, wait there. Talk to somebody, reach out to somebody and talk about it. It's okay. It's okay to talk about it.
Okay, so I have a few questions for you, Doctor and Pastor. So there's been some misconceptions and arguments about diagnosing children at a very young age. I wanted to know, what are your thoughts and opinions on that?
It depends on what is the diagnosis. Some of the mental health diseases, it has to be diagnosed at a younger age. One of them is ADHD, okay? And also we have the defiance. We have children that are very not listening. All those diagnoses, and a couple of them has to be diagnosed at a certain age. When you pass, I believe, I don't want to quote something, but I think ADHD, when you pass 8 years and it's not diagnosed, it's going to be when you get into adulthood, they will not be able to give you the real diagnosis. Some people just come to get medications, the Adderall. So Adderall is a medication that we use to treat ADHD, but it's a controlled substance and it's very expensive. So people try to come to see a psychiatrist so that they can get that medication. If you tell me that you have ADHD at a teenage, I will be a little bit skeptical because it has to be diagnosed at a younger age. So it depends on what is the disorder. Some has to be diagnosed at a younger age, and some has to be diagnosed in a teenage age.
There's also been discussion about medical treatment, especially in the African communities. A lot of parents are against medicines because they feared that it might either worsen the symptom or worsen the sickness or make things worse. What are your opinions on that?
So I do recommend me for mental health treatments. Yes, there are medications for all mental health treatments, And like you said, our African descent, we have all these misconceptions, but it helps a lot. For depression, we use the SSRI, the serotonin selective reuptake, That is the one that we normally give to people with depression and anxiety. And it helps a lot. It improves the symptoms, it makes you be able to function normally. So is bipolar. We have the antipsychotics, the bipolar medications. Some of the side effects is, they call it metabolic syndrome. You have weight gain, and some also develop diabetes in it. But because we know that, we monitor it every 3 months. If I have to put you on an antipsychotic, the second generation, I have to make sure we check your CBC, we check your weight, we check your A1C, and then every 3 months also we have to recheck it to make sure it is in the normal range. Because if you're on a medication for bipolar, you are a normal person, you function. Some patients feel like, no, I'm okay, I don't need it anymore, they relapse. So I recommend medication a lot. Some will go for therapy. The talk therapy is also effective. But if your screening is very high, if your pH 9 is somewhere in the 15, even if it's 8, it's recommended. Anything above 8, you have to get a medication and also therapy. Individual may opt out to the medication, which I try to explain to them the benefits. If it outweighs the risk, I will encourage you to take it. Yeah.
Yeah, thank you so much for that answer. As a successful, beautiful mother, professional, and wife, how do you manage your mental health and stress and balancing everything?
Thank you. My pastor gives, like I'm saying, when pastor is preaching, he knows he's doing his normal work, but that is my therapy. Because most of the things that he talks about, it's like he's talking to me. I haven't said anything to him, but he's talking to me, take a break, Pastor travels a lot, and I kind of see that he takes a break, because he's giving. It's a time that I take a break a lot. I like to travel also a lot. And anything that makes me feel, like I'm not doing any work. I read also the Bible a lot, The Bible is in connection with the mental health. So his teachings, my Bible readings, and taking recreational breaks is really refreshing for me. Yes.
Like I said, Jesus has died for you already. I don't need to die for you. If I need to go, I'll go. And Dr. Bediako, you may not know this. The first time I met you?
Do I remember?
You don't remember, probably, because I don't think I spoke to you. Mm-hmm. But you were not a member of this church. And we'll go to the beach.
Okay.
And we asked members OCC to invite friends. And that was the first time I saw you. And I said, this lady, she doesn't come to church. Thought they would not see her, but there's beach there. Look at her. She was in the thing, pulling that. And she really had fun at the beach. I remember you from that. Yes. Then after that occasion, you started coming to church.
I remember.
So even though as a church, sometimes we have fun. Mm-hmm. There's nothing wrong with that. Mm-hmm. Chill. Yeah.
Go on cruises.
Go on cruises.
Exactly. Yes. Exactly. Yeah. My pastor travels a lot. Yes. It's very good. You just go somewhere. And you see other people, just like pastors, you see other colleagues that whatever you are thinking about, why you came here, we just say, what brings you by? She said, I'm a pastor and I just need a break from my church. I'm a psychiatrist. I'm okay. Then we talk, we have something to talk about. So I do recreational break a lot,
And on the medication side, this may not be my field, but let me say that I know people have a lot of apprehension about psychiatric drugs because of the side effects. But every drug has a side effect.
It does.
Common medication like Tylenol or paracetamol can damage your liver. But still, we take it. What the doctors do, they look at the benefits against the side effects. So it's there, but when they give it to you, they monitor you very carefully to make sure.
Yeah.
And like she said, I have testimonies of people who have gone through some of these diseases that I know of, real people, and taking the medication has really helped them to function normally. Yeah. I remember there was a case where I was called to a psychiatric facility. And as a pastor, many people don't realize it, but the mental health workers always collaborate with pastors because they recognize the spiritual part.
Yes.
So this child, the patient said she wouldn't take the medication because she believed that they were trying to poison her. It was a kind of conspiracy. And I think the friends thought and said, there's only one person this lady trusts, is her pastor. So they called me, I got in my car, I got to the place, and when I went in there, the doctor, the social worker, all of them, they stepped out. But I know they were watching us from behind the glass. She came, she hugged me, we sat down, she told me, I said, no, they're trying to help you. And I explained how medicine is. They are licensed to do this. If they do anything wrong to you, the government will hold them accountable. They can be sued. So whatever they give you, and I just said, really? She said, I'll take it. So she accepted the medication. The doctors were so happy. They invited me to a conference. We sat, we talked about the care and everything. And I let them do their job, and I do my job, And the person is functional. And these are some of the things people don't realize.
Yeah.
I have a friend who runs a company, actually in Ghana, who had an employee who went crazy. I mean, stripped naked in public. And in our context, they will say he's finished. And they took him to the mental hospital. They prescribed some drugs. But we had a friend, a classmate, who was a psychiatrist in Canada. So my friend sent him this medication, and he said, this medication is obsolete. There are better ones on the market now. So my friend paid for it, and this doctor sent a package. And that young man is cured now. He's married, he has a family and everything.
Very cured.
There are people, it works.
It does work.
But when you wait too long, then you have a problem. But when you start treatment early, it's the same with cancers too.
Yes.
If you go for checkup and they find it early, a lot of cancers you can beat it.
They cure it.
Yeah, it's the same with mental health too.
It is.
Let them start the treatment
It
early.
is, yeah.
These are doctors, that's what they are trained to do. They have sworn an oath, they have a license to do this. So let's trust them to do their job well. Yes.
Yeah. And we are here to help. Yeah, we are here. I always say that I'm not here to judge you. I'm not here to add more to your shame, but I'm here to uplift you, to let you know that it's not your fault. You are also a human being. We are all humans. No, nobody's angel. You faulted, but at least you can correct it. And Pastor always says that, if you take a class and you fail, so what? Take it again. Take it again. Whatever it is, you faulted, you get up, you dust yourself off, and then you just change the course, change your strategy, and do it, because you will succeed the second time. Don't let it keep you back, and live with guilt.
Oh, thank you so much. Right now, we know that if someone's going to mental health, it's not about deliverance. It's not about deliverance.
Prayer is good. The Bible says we should pray all the time. Prayer is good, but give what belongs to Caesar, and believe what belongs to Kaiser.
So I have one question. Probably this might be the question that we wrap up. How much does forgiveness play in mental health? And this goes to both of you. Yeah, how much does forgiveness play in? Because I know sometimes trauma from people causes causes something in people's mental health. So how much does forgiveness play a role in mental health?
Pastor, I want to go first.
You go. they say in mental health, they didn't say in spiritual life, so you go first.
So now, forgiveness is a key. It's a key, a raw key. Yeah. So for the examples that I was giving for a young girl that has been, molested sexually, and they are feeling that it's their fault, Even if a married couple's divorce, the children, the number one issue I don't care how old they are, they feel like it's their fault. That is where they have not forgiven themselves. What did I do for my mom and my dad? They didn't want to live together. Marriage, divorce, couples, children Guilt is their number one. All of them, when you ask them, they feel like it's my fault. Oh, it's my fault, it's my fault. So you have to forgive yourself first and know that it's not everything that is your fault. Even if you contributed to it, Pastor said, Jesus Christ came to die for us. No, he purchased his blood with our sin. Forgive yourself first, and then forgive who has offended you, and then you move on. The forgiveness is the key. If you forgive yourself, that's when you'll be able to move on. With prayers, with the scriptures, which is our manual that we all have to live by. You move forward. You have to forgive yourself, regardless of what has happened to you or what you have done to somebody. And we should realize when we offend our friend, we offend another human being, to say, I'm sorry. Just a simple, I'm sorry. You've done your part. Then it's up to the other person also to forgive and then move on.
Yeah, I agree with her too. I think even Jesus talked about forgiveness a lot. I think it all starts with forgiving yourself. Mm-hmm. But when it comes to forgiving yourself, I think I see it more as accepting forgiveness. Because the way I look at life, God is the one I've offended first before human beings. So I want to accept God's forgiveness because he's promised me that if I confess my sins, he's faithful and just to forgive me. So accept it, no matter how bad I feel. And even if others still don't forgive you, accept the forgiveness. And that's where your healing will begin. And also forgiving others. In fact, as a pastor, I would say that's one area where I have seen many people, delivered. It's not the falling down and rolling up, but when people decide that somebody offended me, I'm going to forgive them. It releases you yourself. Mm-hmm. Somebody said, holding a grudge against someone is like letting the person play in your head for free. It affects your relationship with other people too, because you feel because that person hurt you, somebody else will hurt you. So then you begin to withdraw. So you lose that ability to form relationships that can help you, and that can affect your mental health. Yeah, there are many people who are going through stuff they can't share with anybody because one person betrayed them years ago. People who maybe are going through something and they wish it would be known, so that people will pray for them, but they can't because they are afraid because one person went and leaked their secrets. Mm-hmm. And what I tell people is that, look, if 100 people know my problem, and say even 20 of them gossip, I have 80 people praying for me. Mm. So personally, maybe it's my personality. Sometimes the coworker told me I have a type C personality. Nothing bothers me. When we are in a meeting in the corporate workplace and everybody is trying to blame, I say, look, all of you blame me. What are they going to do to me? Fire me? So it's all a matter of attitude. And I think when you also find it difficult to forgive, it's a sign of pride.
It is pride.
Yes, because you feel as if though you are so good, nobody should offend you. But if you know that you are not good enough, when somebody offends you, who cares? So who am I? It's not that you don't have self-worth. You have self-worth, but you don't want to carry it too far, And that's how I look at it too. So forgiveness, some of us need to go out there and find people who have offended us, people we are angry with, and just call them and say, look, I let it go.
So men are always going to be men, Men are always going to be men. But the most interesting part, when they come talk to me, when they are leaving, there's, oh my goodness, you are so easy to talk to. Because I make it so lively, There's no harm, no fear. It's very safe. You feel comfortable, We start just from the bottom. How is the weather? Was it difficult for you to find the location? I just make it very casual, like a normal conversation. And they start flowing. So at the end of the day, when the session is finished, even whatever I recommend for them, just say, oh, I trust you, I'll take it. I wasn't going to take, my wife told me to take this and I wasn't going to take it, but I trust you, I'll take it. No, it's because I made it feel so comfortable. When they meet me, I made them feel very comfortable that they are humans, like you are saying, they are men, they are humans. Talk, open up, let somebody hear what you are going through, when somebody understand you, just share your fears, share your struggles, your spouse. And if you have a spouse and you are the young entrepreneurs, what I always encourage them to do is if your business is very young, just try to find something to support it because you are working for you. It takes time for the check to come in. So don't just wait because it's another depression for you. It's another stress. Find something, even if it's a part-time. I know you have all this ego, you want to be your own boss, but, don't bite what you cannot chew, or don't let people see where you are not. People want to portray that they have arrived when they are still at the beginning of the business. Find something supplemental, even if it's a part-time, because you can't leave your business that you want to grow. So find something that at least is something that is coming in every 2 weeks. Don't portray more than you are to people, because if you portray more than you are to people, and somebody sees that you are working in Walmart, they'll be like, oh, I thought Kwabena said he has opened his business, and now he's,
Like working night shifts.
Yes, yeah. It is okay. It's a new business. So don't let people see that wherever you haven't stepped yet, you are already past. Be normal, be yourself, because we are the ones that will bring all this stress to us, because we show more than we are. And once you show that, people are going to have all these expectations from you. So if you are doing something to supplement your business, they'll be start gossiping about it, and you feel like, oh, somebody will see me working. But deep down in your heart, you need it. Do something before your business gets to a certain stage. Talk to somebody. If it's a man, close man, let them say, no, Charlie, this way, you. What can I do? Or this is how I'm feeling. And your wife also is your friend. Pastor always says that. Don't you see Pastor and Mama Julia all that? They are friends. Let your spouse become your friend. So if you are struggling, your spouse should be the first person that you should share with. Women, we are the helpers. Some women make more than the husband. It is okay. There is no who is first and who is last. It's a family. We are sharing. So let your spouse know your struggle. And then she steps in to be the helper, as the Bible says. That's what wives are there for. So talk to somebody. Don't let it keep in. Don't man it. Don't man it. It is very unnecessary to man it. Because you keep manning it, you get to a point that you feel like it has gotten into so much. When am I going to open all these pages? So maybe I should end it. I was reading an article about why celebrities commit suicide. They have all this money. You are sitting here counting pennies. You see, example is Whitney. I was one of the female celebrities that I truly admire because of her voice. And when she committed suicide, I started researching, why will a woman like this commit suicide? And it's because what Pastor was saying, they are giving. Society is expecting more from them. Their family, they are giving. They have nobody. So they sit back one day and say, what is the point of this? Some checking into a hotel. I think she also, she was in drug addicts and all that. And they find a recreational that will numb the loneliness. And they are lonely inside. And they are not like us that we know Christ. So they handle the loneliness with addiction. And then they get to a point, feel like maybe whatever medication that they were using, you become tolerant to it. If you were using $200 of whatever medicine they use, it will get to a point you have to purchase $1,000. And as you keep increasing, you still have to get to a stage before you feel yourself satisfied. And they sit back and feel like, oh, this is not, because they are humans too. So last year I was using $100 of so and so drug to make me feel comfortable. Now I'm using $2,000. So it's like every year they still need more medicine to numb the pain. So they check out quickly. They check out. There's a proverb in Akai says, something they say it's like if something is going to be for shameful, you take death over shameness.
Yeah, it's over shame. We take death over
Death
shame.
over shame.
But that's a wrong proverb. And that's why you see, and what I'll tell men is this, for men listening to us, God made man. And then God looked at man and said, it's not good for man to be alone. I'll make him a helper. Which is, man needs help. But the primary help God gives to our spouse, we keep them out. I see many men who are going through financial problems, they can't food them, they will never share it with their wives. But it's God who said it, it's not the woman who said it. God looked at you and said, It's not good you should be alone. I'll make you a helper. He brings the help, and then you turn your back on the help. Probably God saw the condition of the garden. It was terrible, man. Dishes all over the place. Adam was, not balancing his checkbook well. My wife, for example, is very detail-oriented. She writes notes on everything. She tallies everything. Because of my career, I used to work in finance, but I work with very huge figures. So I'm not very detail-oriented. So I have to come to a point in my life where I say, look, honey, you are better at this than me, so you man the checkbook. This will say because I'm an African man, I have to control the money. And always I'm bouncing checks. Ask for help when you need it. And when we were off camera, I was saying something to them that I worked in health insurance pricing. And what happens is that when you look at life insurance, women tend to have lower premium than men. You take two people the same age, male, female, they rate females as a better race because they don't die early. They tend to live longer. When it comes to health insurance, it's the opposite. The women are at a higher rate, but they use health insurance more. They see the doctor, they go for therapy. So their expenses go up because we price with cost. So women pay higher premium. So the men, we bottle it all in, then we die early. By the time we get to the hospital, we are almost dead. So we need to change that trend. Open up, tell your wife, honey, I can't handle this. Can you help me? And you'll be surprised the ideas they will give you. A lot of things that I achieved, even I tell people in the church, we think I'm wonderful, but a lot of times it's my wife, I tell her, I don't know what to do. Like when COVID came, we were talking about depression and all that. I was sitting at home and I figured people were going through things alone. I used to hear news of people who were depressed, tension in the home and so on. And I was voicing my concern. What can we do to connect people? My wife said, let's do the movie project. I'm like, what is that?
Beautiful.
And then she explained it to me, got on the phone, got people together. Let's pick a movie. Let's watch it. And so people will watch movies in their homes. Yes. Especially those who are even alone. Then Sunday evening we meet and we have a discussion of the food. So people, for example, we're talking to people, not just about church, but about what went on in the movie, funny issues, relationship issues, and so on. It created bonds. Then after COVID, when it stopped, we said, no, we don't want to stop. And they are still continuing with it. But it was all my wife's idea because I bounced it off her. I didn't know what to do. I sought help. I have a leadership team here I work with, and some pastors tell me, I have a large leadership team. It's because I can't do everything alone. I'm one man. I have certain strengths and weaknesses. So the more people I work with, the more strength I can depend on their strength. So let's be open and allow people in our lives. Men, we are too...
Women are less men 70% of the time.
Yeah. And it's not the women doing it. We do it to ourselves because we are not willing to get help.
Because we need to go to the hospital to work.
Yeah, we need to. Every year, go for your physical. And one time we had a health fair here and I was talking about going for physical and somebody said, oh, the colonoscopy, the digital exam, man, is too invasive. And I said, just wait. Do you know how invasive an autopsy is?
That's because you are not seeing it. Mm-hmm.
Think about it. Yes. It's autopsy is so invasive. So let us do this one. And for some reason, every time I go for a colonoscopy, it's women who do it.
Don't take the woman.
But so the men, we need to relax. God has given us the help we need. We need to relax. I don't want to get to heaven one day and God will ask me why you didn't come before your time. I said, God, I couldn't find help. Your help was right there.
Yes.
You never utilize it,
Utilize your spouse. Yeah.
Wow.
Utilize your spouse.
Well, this has been an amazing discussion. We will have to have a part 2 of this year. So before we wrap up, let me start with the doctor. Do you have anything to say?
Well, I just want to thank Dr. Bediako for coming and for sharing with us. I think we've learned a lot. I wanted to hear from, she's a professional and she knows this more than I do. It means I don't know everything. So I have more experience maybe in life than she is because she's a young lady compared to me. But she also has a perspective she's bringing. And that's a help issue. We needed help and we got help. And so if you need help, please get help. Thank you.
And doctor, so before I let you go, first of all, if someone is looking for you, because I know a lot of people after watching this, they'll reach out to you. Can you please let us know where everyone can find you, if they need someone to talk to, where they can reach out to you, maybe if you have like a web number, yes, or your establishment, wherever, please just go.
Okay, thank you. So yes, like Kwabena said, I have a practice in Silver Spring, so telephone number is 240-564-7146. 240-564-7146. On Tuesdays, I see patients in person because I have another job, like I'm saying. So on Tuesdays, I go to the office. If you want to see me in person, it has to be a Tuesday. Every other day, I can talk to you virtually. I also have a website, www.Blessing Medical Consultant. And we are on the social media, all the social media platform, on Instagram, blessingmedicalconsultant.com, Facebook. And now I just set up a media in Ghana that once in a week, I do a video and then it goes to TikTok viral. And then if anybody needs help, all the social media handle, just type in Blessing Medical Consultant. We are there. I will reach out to you. When you call me and I don't pick it up, I will respond in a timely manner. If you send me a message on a website, it comes to me, I'll also respond. And I will talk to you, set an appointment and talk to you.
All right. And do you have any final words to say?
Yes. So my final words to everybody, mental health is real. No, it's a disease, just like headache, shoulder ache. If you are feeling not yourself, you know yourself, talk to somebody, ask for help. We have a crisis center, a national mental health crisis line. If you dial 911 and you tell them that you're having mental issues, they will give you the crisis telephone number. And there is a professional 24/7 that they will talk to you. If you're having suicidal, check yourself into the emergency room. They will help you. They are not there to harm you. They are there to help you. So seek help mentally. If you are going through anything, your children comes to you for school failures, school age, college students, it's very, very, very important. Their grades are very important to them. We look at it very minor, but it's not. It's a major failure for them. When they come to you, even if it's a C, Pastor said, a C, so what? It's moving you forward. You are not repeating the class. Even if you are repeating the class, repeat it. You will be better. You will be wiser. Nothing is worth taking your life. Let's speak up. Let's seek help to prevent suicide.
Wow. Thank you so much. Thank you so much for honoring our invitation.
Thank you.
God bless you so much.
Thank you so much for coming.
Yeah. So this has been the LifeUnpacked podcast with
Dr. George Ademinta
and Kwabena Boateng. We are out. Stay blessed.